views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hi, and welcome to Open BXR Tuesday on BronxNet, a weekly program providing you the latest information, resources, services, and community efforts taking place locally here in the Bronx and virtually. I'm your host, Sonyi Lopez, and today is Tuesday, September 7th. Coming up, how are healthcare transportation challenges associated with certain chronic health conditions? We'll learn more about this through a new study by researchers at Montefiore Health System. Then, overdose deaths increased in the first 9 months of 2020, with the most deaths occurring here in the Bronx. Our Montefiore expert joins us to share what caused this surge in our borough and how overdoses can be prevented moving forward. After that, we'll share some of BronxNet's recent back-to-school coverage with stories across our borough. And keeping with the back-to-school theme, we'll discuss why many educators and parents feel that the DOE's reopening protocols and procedures are rushed with the MORE-UFT Caucus. So please, stick around. Open BXRX Tuesday starts now. Welcome to Open BXRX Tuesday on BronxNet. I'm your host, Sonyi Lopez, and I'd like to invite you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. A new study by researchers at Montefiore Health System found that healthcare transportation challenges are strongly associated with certain chronic health conditions. Joining us now to discuss this in detail and more is Dr. Kevin Fiori, Medical Director at the Office of Community and Population at Montefiore. Welcome, Dr. Fiori. Thank you so much for joining us today.
Thank you for having me.
Of course. So first, I'd like to learn about your role as the MD at Montefiore's Office of Community and Population. Can you tell us a little bit about that?
Sure. So I am a general pediatrician by training, and I'm also a researcher. So I work at the Office of Community and Population Health in looking at the data that we have about the communities where Montefiore works, and trying to find ways to use that data to improve the care that we provide to the Bronx community. So I specifically within the office focus on what's called social determinants of health. So things outside, where people live, work, the conditions that may shape their health. I look specifically at those factors and how Montefiore can understand how that affects the communities that we get to work with.
Thank you for that. So now we're talking about this new study,
Yes.
including on healthcare transportation. So what did Montefiore find in this study, which highlighted healthcare transportation challenges? If you can share, Doctor.
Great. It's a great question. So I just want to make clear that the study was we weren't targeting health transportation per se. We were looking at an array of social needs that our patients answer as part of their visits at Montefiore. And so we looked at 10 different social needs. And what we found, which was quite interesting, was that health transportation tends to be mostly associated with a lot of the chronic disease conditions that our patients have. And so that was a stark finding among all the things that we ask about. We ask about food, having enough food to eat, the condition of the housing, the condition of, whether you're able to pay your rent. And of all of those needs, health transportation seemed to stand out as just being a barrier. We think it's a barrier to accessing care. So it was an important finding. And we looked at over 35,000 Montefiore patients.
What were some of those chronic conditions, Doctor? If you can break that down for us.
So we looked at, I would put them into three buckets. So we looked at sort of health behaviors like smoking, alcohol abuse. We looked at chronic disease conditions like hypertension. We looked at diabetes and asthma, the sort of leading chronic conditions. And then we also looked at mental health conditions, so depression, anxiety.
Got it. Thank you for that. And those are pretty prevalent in our communities already. Diabetes is, high in our communities in the Bronx, as well as chronic heart conditions as well. No?
They are. And I think the question is, there are things that we do as a health system, as Montefiore, to help with those conditions. But there are things that affect those conditions that happen outside Montefiore's clinical walls. And so one of the big take homes from this study was, how can we as a health system, working with community members and families, how can we better understand those needs? Because we know that they affect whether your asthma is well controlled. So as an example, I'm a pediatrician. I see lots of kids with chronic asthma. I can talk to families about, you need to take your controller medication every day. But if there are other things that are happening in that household that may be affecting whether they can take that medication, like, for example, we don't have enough food to eat, or we're behind on rent, or the quality of our house is just, not sufficient. We have mold, we have pests. That's going to affect whether that family can actually take that medication. And it's important as care teams and providers that we understand that, because our patients and our families and our communities deserve that.
Right. And you helped give us a name for that. It's called social determinants of health, SDOHs. Which determinants are most prevalent in our community, doctor? I know you mentioned the relationship between asthma and mold. There's also other things such as infrastructure, like highways, where people live.
It's a big topic. And so in general, social determinants are conditions of the environment where people work, play, worship, and that affect their health. We know that. There are positive social determinants of health, like green space. There are negative social determinants of health, like poor quality of housing. I would put the poor or the adverse conditions into a social risk bucket. And then on top of that, and something that we focus on at Montefiore and Einstein is targeting what we call social needs. So that's a subset of social determinants of health where the patient or the family actually says, I have this need, as opposed to, poverty in general, or environmental conditions in general. So the patient is actually telling us, hey, this is something that I've identified that's affecting my family. And so at Montefiore, we were really focused on understanding not only these broad social determinants or social risks using population level data, but also on an individual perspective, what are the needs that are affecting this individual in front of me, or this family in front of me?
Right. Who better than the patient to identify that, we're the experts in our lives.
You are the experts. I mean, moms and dads are experts in anything to do with their kids. And so they are a partner with us. And so that's how we have to look at this. And we want to get away also. And I think this is a really important part of the study, is not making assumptions about what a community may be facing based on data that is, aggregated. It's taken from, big data sets, but may not actually reflect the individual experience of that family. And that's key. And we will only know that if we ask the family, because they're the experts, as you say, in their own experience. And they'll also be the partner in finding a solution to that problem that they've identified.
Thank you so much for that, doctor. So going back to the survey, how and when was it conducted, and who were the participants in the survey?
It's a great question. So the survey was actually not intended to be a research study. So we started about 3 years ago, asking patients that walk into that utilize our primary care practices to, we asked them about social needs, with the goal of being able to identify these social needs and provide meaningful resources to those families or individuals. So that was happening in our health system for the past 3 years. What we did as part of this study is we just collected all of that data that already existed. In this particular study, we just focused on adults aged 18 and above.
Mhm.
And we asked the question, are there associations between social needs that individuals are reporting and particular chronic medical conditions that they may have?
Right.
And so that was sort of the nexus of this particular study.
Right. Thank you for sharing that. So, as we understand, the study took place prior to the pandemic. How has the pandemic affected SDOs, which we're talking about now, social determinants of health? Would you say that these numbers could have been higher due to other present factors such as lack of employment, inability to pay rent, etc.?
Yeah, it's a fantastic question. I'm going to give you an answer that's probably not answering the question totally, which is I'm not sure. My assumption is that based on some of the unemployment rates that we've seen in Bronx County, the increase in unemployment, that has likely led to increased reporting or prevalence of social needs. It's unclear with, for example, the American Rescue Plan of 2021 and a lot of the investments that came both federally and also from the state, how much of that blunted that effect. But my concern is that, and we're not out of COVID by any means yet, but with the vaccination rates increasing, that the economic consequences of COVID are going to be with us much longer than the clinical consequences. And so I think we need to start planning now as health systems, as governments, to prepare for that we're going to see it. We're going to see these social needs in the families that come into our clinics, and we're going to have to find ways to partner with community-based organizations, with governments, with the Department of Health, in finding ways to address or mitigate these issues, because they ultimately influence the health of the patient. So Montefiore, we are taking a proactive approach in trying to understand the extent of the problem at the individual level, and finding meaningful ways to help families address those problems.
Right. And absolutely. Thank you for that. And, one of those ways is conducting surveys like this to assess these challenges before things like this happen, like COVID-19, and the pandemic exacerbates all these issues that already existed before. So I'm sure Montefiore will keep us up to date and continue to host.
We'd love to. Yeah. I think being aware of the problem is the first step. And,
right.
You need to ask individuals, we're very keen on not making the assumption and, asking families what they need.
Thank you so much, Dr. Fiori, for your time today. Before we go, just if you can just emphasize how Montefiore is seeking to address this transportation health challenge for its patients moving forward.
Yeah, it's a great question. So, informed by a lot of the data that we've collected so far, we've actually launched several pilot programs to explore, possible rideshare partnerships, ways to address gaps in public transportation. So these things are ongoing, and we would be happy as they develop to share sort of the results with those. Again, it's to our advantage that we have this data, so that we can target and tailor those programs to particular patients and individuals that may need them the most. And so that's what we're hyper focused on. My office is focused on moving forward. How do we use data to figure out which families and individuals need help, and how do we target and tailor those interventions around that.
We welcome you back to discuss any updates on that access. Thank you so much, Dr. Kevin Fiori, for joining us today.
Thank you.
We'll be right back here on Open BXRX Tuesday. Welcome back. In New York City, overdose deaths increased in the first 9 months of 2020, with the most deaths occurring here in the Bronx. Opioids and fentanyl are involved in a majority of those overdose deaths, many of which are preventable with naloxone. Joining us now to share why overdoses surged in 2020, how to recognize and treat signs of overdose, as well as the best available treatments for opioid use disorder right now, is Dr. Kristine Torres-Lockhart, MD at Montefiore Health System and Assistant Professor of Medicine at Albert Einstein College of Medicine. Welcome, Doctor. Thank you so much for joining us today.
Thank you so much for having me. Glad to be here.
Of course, glad to have you. So we have this terrifying, sad news of what's going on in our community with opioid overdoses. Doctor, can you talk about this overdose surge last year and how and why did this happen?
Sure. Yeah. So nationally, throughout the United States, we're seeing huge surges in opioid-related overdoses. And this is something that New York State is not immune to. And so, like you mentioned previously, New York City has seen the highest number of opioid-related overdoses in 2020 than we have ever seen in any preceding year of the opioid crisis. And so, like you mentioned as well, the Bronx in particular has been particularly hard hit by the opioid crisis. And when you sort of compare us with all of the other 5 boroughs of New York City, we have the actually highest number of overdoses. And again, this is the highest number we've seen throughout the crisis. So why exactly is this happening? I think it's really due to a number of different factors that have sort of culminated in this perfect storm. And many of them are related to the COVID-19 pandemic. So I think first and foremost, we're seeing increasing rates of isolation. So patients who previously might have been using with other people now are using alone due to, quarantining, social distancing, lockdowns, etc. And so we know that people that use substances alone, no one's there to sort of monitor them, and they're at increased risk of overdose. We're also seeing sort of changes in the drug supply as well related to the pandemic. So people may be using different supplies or different suppliers that they previously had not been and aren't totally sure what's in them, many of which have been adulterated with fentanyl, which we can chat about more too, but is a very powerful opioid that's like 50 times more potent than heroin and also contributing to a huge number of our overdoses. And then, of course, the pandemic has just contributed to a ton of anxiety and stressors for people everywhere. And many people cope by using substances. So we're seeing people using more substances just to cope. And then, of course, just lack of access to treatment. So whether that be mental health treatment, so they're not able to access treatment for their anxiety, depression, et cetera, with all the stressors of the pandemic. And so they're left to use other things. And then, of course, access to treatment for opioid use disorder itself. So with many clinic closing, also having limited availability to take new patients, patients just aren't able to access life-saving medications like they used to. And so I think all of these things together have made it a really troubling time for us to see all of these overdose deaths.
Wow, so many different contributors to the overdose crisis here in our borough. Thank you for sharing, Doctor. So you did mention fentanyl. Can you help us break down what that is and also learn about which other types of opioids cause the cause in surges of death in our borough as well?
Yeah. So when we actually look at the New York City Department of Health data, when we look at what substances are involved in overdoses, we see that by and large, more than one substance is usually involved. So we can't always say this was the one thing. By and large, most people have multiple substances in their system in the setting of an overdose, whether or not they were intending that. But when we look at the whole culmination, over 50% involve fentanyl. So like I sort of mentioned a little bit before, fentanyl is an opioid. It's a synthetic opioid, which means it's man-made. It's usually produced overseas and illegally brought into this country, and essentially adulterates almost every single drug supply we have, at least in New York City. So it's 50 times more potent than heroin and incredibly cheap. So it's very easy for it to get into the supply to make a drug seem more potent as well. And so, but it's really hard for people to know exactly how much fentanyl is in the supply. So can be using things that they don't know are incredibly potent. Increasingly, we're also seeing other opioids in overdose-related deaths. So heroin is the second most common opioid found in overdose-related deaths. But we're also seeing other substances that are not opioids, but other sedating medications that sort of put people at risk of respiratory depression or sort of stopping breathing. And those are things like alcohol, and then also benzodiazepines, which also go by things like Xanax, Valium, Klonopin, things like that. And then the most alarming thing is that, we're also seeing fentanyl in things that aren't even depressants. So they're things that are in supplies like stimulants as well. So maybe people who are using cocaine or amphetamines and aren't used to using opioids at all, there can be fentanyl in those supplies too, and put people, of course, at much increased risk of overdose because they're not even tolerant to any sort of opioids previously.
Doctor, and there's no other way to determine if these substances have fentanyl in them until someone intakes them, right?
So there actually are some things that are distributed through the Department of Health, and we also do this at Montefiore in some of our hospitals and in our clinics. They're called fentanyl test strips, actually. And so we distribute these directly to patients, and these are often distributed in syringe exchange programs as well as a harm reduction tool. And so patients can actually test their own supplies in real time and see if fentanyl is in them. And then if it is, they can either choose not to use that substance or use it in a more safe way. So use it in the presence of other people, use a smaller test dose, or use it in the presence of naloxone or Narcan being nearby with other people.
Got it. We'll definitely talk more about naloxone and Narcan a little later on. But I wanted to ask, Doctor, could these deaths have been prevented? If so, how?
So something I feel really, really strongly about is every single opioid overdose could be prevented and is a preventable death, which makes it the biggest tragedy of all. I think first and foremost, just having access to naloxone or Narcan is the number one way we can prevent overdoses. Oftentimes we distribute this and make sure patients who are on opioids or have opioid use disorder have it. But also if you or anyone you knows someone or lives with someone who has opioid use disorder or uses opioids should certainly have it. Anyone who's using stimulants, like I mentioned before, for the reason I talked about, there can be fentanyl in those supplies without even knowing should have access to naloxone or Narcan. And then also, I just believe it's something that should be in the hands of every community member, just given that we are in the midst of an opioid crisis. And so folks can actually get naloxone or Narcan really easily in the state of New York State. So they can either get it prescribed by one of their providers, but you actually don't need a prescription. You can essentially go into any pharmacy, and there's this thing called a standing prescription. So any adult in New York State can actually go into any pharmacy and get naloxone from a pharmacy as well, with some training on how to use it, and just have it at all times, just in case you ever see any other community member who's overdosed and can save a life. So I think access to naloxone is the biggest thing we can do to prevent overdoses, but also just making sure that people who use opioids and have opioid use disorder have access to the life-saving medications that we know are incredibly, incredibly efficacious at treating opioid use disorder, decreasing opioid use, and literally saving lives and preventing opioid related overdoses. So the main ones are really methadone and buprenorphine, also known as Suboxone. And then lastly, this is something that's done in other countries and not in the United States yet, but is this idea of a supervised consumption site. And so these are actually places that are staffed by professionals who are very savvy in how to respond to opioid overdoses. And they have provide access to sterile supplies for people who are using substances and opioids. And people can actually use opioids or whatever drugs safely in that vicinity, be monitored. And if they do experience an overdose, they're able to respond in real time. And so these are things that are seen in other countries like Canada and in Europe, and no one has ever died in the setting of one of these things. And they also often provide supportive services, linkage to drug treatment programs, et cetera, and can be really helpful for people's health. And so I think that's something that we need here.
Absolutely. Thank you for sharing, doctor. And you did share some great treatment options and, these important treatments that are available via Montefiore and many other organizations in the Bronx as well. But how can we recognize that we need to assist someone who's having an overdose? What are some of those signs and telltale signs that we should be watching out for?
Sure. So first and foremost, someone is not responsive. And so they are not responding to voice, or maybe they're not responding to touch when you're trying to arouse them and wake them up. And something we also sort of think about and we train people doing is something called a sternal rub. So it's essentially taking your knuckles and rubbing on the sternum. It can be very uncomfortable. So if that doesn't wake someone up, we consider them unarousable. Also, you might notice that maybe they're not breathing or that they're breathing very, very slowly. Maybe they even have like a tinge of gray or blueness to their skin just due to lack of oxygen, or maybe they're having some strange breathing sounds like gurgling. Those would all be indications that someone might have overdosed. And the first thing that you always want to do is call 911 and let them know that someone you think has potentially overdosed. And then, of course, if you were to have naloxone on you, you could administer it at that time. It's an intranasal spray that you just sort of insert into the nares and spray once, and that delivers the medication as well and can reverse an overdose within minutes. But again, you want to make sure you call 911 because that medication can wear off after about half an hour, and folks can still re-overdose with some of the medications that are still in their body.
Got it. And I definitely wanted to emphasize to our viewers that anyone can administer naloxone. You don't have to be, an expert or anything. Of course, you will receive training once you pick up the naloxone and Narcan kits, but you can carry with that whoever you are to help someone who is having an overdose. Doctor, without further ado, how can people access this treatment, whether it be naloxone, buprenorphine treatment, and methadone treatments through Montefiore here in the Bronx, if you can share any resources or contact information?
Sure. So Montefiore has a really long history of treating opioid-related harms across the Bronx. And so we have 5 different methadone clinics that serve over 3,000 patients in the Bronx with methadone for the treatment of opioid use disorder. And so please call the number listed on your screen if you want to be linked to care. Also, you can always just search online Montefiore opioid use treatment programs and be linked to one of those programs either same day or next day for really close follow-up. Additionally, if someone's interested in buprenorphine or Suboxone, again, another one of the approved and efficacious treatments, you can go to this website, montefiore.org/buprenorphine, or call the number below. And again, you can be linked with a primary care provider who can prescribe buprenorphine in a primary care setting, again, at one of our 7 sites across the Bronx and East Harlem. And then all of our clinics and our hospitals actually as well also provide naloxone distribution to our community members as well. And again, on some of those websites, you can actually link up with one of our community health workers who will be able to do the training as well for community members and give out some of these naloxone overdose prevention kits too.
Thank you so much for this wealth of knowledge, Dr. Torres-Lockhart, and thank you for joining us and sharing more about this rise in our community.
Of course. Thank you so much for having me.
Thank you. We'll be right back here on Open BXRX Tuesday.
We know that people are dealing with the health crisis, but there's also a lot of food insecurity.
We're giving out healthy food options, and that's what's key here.
If you're a senior, you have a disability, they'll actually deliver meals to you.
The residents are anxious, they're worried, they're scared, they want to be tested.
When things were happening in our community, and we couldn't get the help.
There's almost a presumption of criminality that attaches to your skin color.
The site will prioritize those who are at highest risk in the population.
If you feel symptoms and you'd like to visit one of these COVID-19 testing sites here in the Bronx, you may call the State Health Department's hotline.
Important to note about this site is no reservations are needed. This is a walk-in clinic.
A lot of us are out of work and looking for something to do.
We have the machinery and the skills to make large scales of these masks and gowns.
Take care of your people. It's going to go way further than we actually can understand.
Right now, employees like myself are just adjusting to the new reality.
Reporting from BronxNet, this is Fiori.
Welcome back to Open BXRX Tuesday. With impending school reopenings coming around the corner, our BronxNet reporters went out to cover back-to-school events throughout the borough. Let's check these stories out.
It's back to school in a matter of days now, and these kids are ready here at 991 Longwood Avenue.
Why did you pick that one? Why?
It's glittery.
Through a partnership with Baldor Specialty Foods based in Hunts Point, State Senator Luis Sepulveda and City Council member Rafael Salamanca Jr. are working to relieve some of the stresses involved in preparing for the first day of class.
Bien, está muy bien.
This is an annual event that Bronx Community Board 2 hosts every year, and I'm just proud to be able to contribute to this event.
We have over 700 book bags, over 700 snacks, kits that we give out.
For Nikhil Kozla from Baldor, it is an opportunity to see the impact his company makes.
This is my first year doing it, and my VP and CFO were here. They said we need some hands, and I said, this is fantastic. Why not?
It was book bags and additional resources to protect against COVID-19, shared State Senator Luis Sepulveda.
We're giving out face masks. We're giving out information, educational information for our children. Anything that you need, we're offering services. It's a great event. We've done it every year, and you see so many people here.
Other activities included elaborate face paintings, Robin maybe. Here's 12-year-old Henry Medina showing up as himself.
I got a book bag. I'm going to get me some food now, and I'm going to win me a raffle.
If you could say anything to Baldors that provided this, everyone, what would you say to them today?
Thank you for this book bag.
A lot of Wonder Women here today. If you missed this event, there will be others. Just go to council.nyc.gov/district-17. For BronxNet, this is Arlene Makoko.
As New York City public schools and universities reopen for full classes, Hostos Community College is celebrating the milestone with an outdoor festival.
I feel amazing though. Yeah, I wish I was in person before I graduated, because graduation was online, so we didn't have to celebrate, but it's a good experience coming back. Welcome back, Hostos. We're gonna do it together. And please, wear your mask and stay vaccinated, please.
It was an afternoon of fun for Hostos students and faculty members to help gear up for in-person classes while following safety guidelines. Community members were also invited to learn more about the professional gateways Hostos offers.
We have still predominantly online or hybrid courses. Hybrid means they come to take tests and things like that. But services like the library, the computer labs, the child care area will be open to serve the students, and that's huge.
As the Delta variant emerges, there's a steady rise of coronavirus cases in the city. Educators are keeping a close eye on the indicators, but for now, the mayor has insisted no changes with the reopening plan.
We are hopeful that we can manage this new Delta variant. In the meanwhile, we're very, very careful in the classroom. Social distancing, masking, students have to be vaccinated, the faculty and staff as well. If not, they have to show proof of testing.
New York State Comptroller Thomas DiNapoli joined the celebration and gave his remarks on Hostos' comeback and how the college is a stepping stone for many first-generation college graduate students.
This is a college that really is a gateway of opportunity for so many. And really, many of the students here, first time anybody in their family could get to go to college. And Hostos is very accommodating to different work schedules that people have to have, really supportive of the students, very dedicated faculty. And really, they serve as a community resource as well.
The college means the world to many people. It's an immigrant college. The groups change through the years, the different groups, they graduate, they do better, they get a little house, and we get a new group.
Students scheduled to attend any class on campus in fall 2021 will be required to be vaccinated or show proof of negative COVID-19 tests. All City University of New York CUNY classes begin Wednesday, August 25th. Reporting for BronxNet, Ashley Tiffany.
Ensuring Bronx students have the tools they need for the upcoming school year, the Bronx Community Action Team under the organization Phipps Neighborhood held a back-to-school giveaway. Director of Community and Public Safety Willie Thomas says this community engagement project comes after seeing the aftermath of COVID-19.
Our young children getting ready to go back to school in September. The pandemic had hurt families economically, right? To a point that we can't even imagine.
Hoping to ease the minds of parents still dealing with the economic effects of the pandemic, the organization handed out backpacks filled with notebooks, pencils, and PPE for students in grades K through 12. Excited for the return of in-person learning, middle schooler Joshua M. appreciates this effort.
I feel good because they're helping other people that need, and some people don't have money to afford to buy expensive stuff.
In an effort to add fun to the task of getting school supplies, BCAT also provided the community with a barbecue, music, and face painting. This is just one of the organization's many efforts towards building a stronger and safer community.
We need an opportunity and we need a safe space where people could come out and just enjoy themselves, have a family atmosphere, and relax.
It doesn't have to seem boring. It could be a community thing. And also it provides people with the opportunity to get to know each other within their own community, see each other face to face. It's very important for these students to come out here and just engage.
If you missed this event, do not worry. The organization plans to take this initiative all throughout the Bronx just in time for that school bell. To learn more, visit the link below. Reporting for BronxNet, Kib and Aline.
Thank you to my colleagues at BronxNet for covering all those events. When we return, we're going to speak to an educator who is actually concerned about school reopenings. We'll be right back with more Open BXRX Tuesday.
If you're struggling to afford your internet bills during the pandemic, there's a temporary government program that may be able to help. It's called the Emergency Broadband Benefit, and it provides up to $50 monthly discount on your broadband bill to qualifying households. Find more information about the program, including if you qualify and how to enroll, at fcc.gov/broadbandbenefit, or call toll-free at 833-511-0311. That's 833-511-0311.
We built a media network for you.
BronxNet TV.
Come learn in your new state-of-the-art studios at Lehman College.
At Mercy College.
And coming soon to the South Bronx in the Hub.
Inspire with your stories, culture, history.
Your Bronx. on BronxNet.
Engage with us.
Connect with us at your channels and at BronxNet.tv.
Learn, engage, inspire. BronxNet TV.
From the Bronx
to the world.
BronxNet.
Welcome back. With the first day of school just a week away, Mayor Bill de Blasio and Department of Education Chancellor Maisha Ross Porter recently announced New York City school safety guidelines for students and staff this year. However, many feel the DOE's protocols and procedures are rushed, and the Caucus UFT say that these measures are simply not enough. Joining us now to discuss this and more is Annie Tan, a special education teacher and activist, and as well as a member of the MORE-UFT caucus. Welcome, Annie. Thank you so much for joining us today.
Thank you for having me.
Of course. So, firstly, I want to start with just asking, how are you feeling? As an educator, I can imagine that this upcoming school year is bringing a lot of anxiety, a lot of mixed feelings for yourself and your colleagues.
Yeah, so I'm scheduled to go back to a windowless classroom next week, and I am terrified. I've seen colleagues who have ceilings with holes like there and liquid dripping, and we've seen like classrooms that like my colleagues across the city are saying like have mold and have all these other features that have never been fixed because we have been severely underfunded. So I'm very scared. My colleagues are very scared. And I think the difference now is that one, we have the Delta variant, but two, we're gonna have overcrowded classrooms because all the kids are coming back.
A windowless classroom, that is insane to just think of with a pandemic. And, the fact that this happened last year, and now it's happening again this year, must be just anxiety riddling for everyone.
I wanted to say that my classroom wasn't windowless last year because the majority of our students last year were remote. And because our students, most of our students were remote, my students could have a classroom with windows. And it's because my classroom is a smaller classroom. I'm a special education teacher with 12 students that we are in a smaller room. But because we're in the smaller room, we have to take the classrooms that are smaller, which are the windowless ones. And that's not okay.
Wow. Well, thank you for sharing that, Annie. We mentioned the protocols, the safety protocols that the mayor and the chancellor released earlier this week. What were your thoughts upon receiving these guidelines from the mayor and chancellor? And from your perspective and experience, are schools ready to reopen come September 13th?
No. I think that in-person learning is always better, but we need options for especially my elementary school students who cannot be vaccinated at this point. And I've heard concerns since May when the mayor announced this plan that a number of my students' families and a lot of students' families across the districts were not ready to send their kids back in September. They were not going to risk their kids' lives or their families' lives. And the main thing that struck out to me was ventilation, right? We have these district reports saying my classroom's safe just because we do have a supply and exhaust fan, but we have other cases where, like as I said earlier, my classroom doesn't have windows, and it has 2 air purifiers that aren't HEPA certified, and I should be very worried since I don't have windows in my classroom. But testing is a huge part of it that I am very worried that the DOE's testing policy of testing 10% of unvaccinated kids who give consent is not enough, because if parents don't give consent to their kids for getting tested, then really we're only going to have about 2-3% of our population getting tested twice a month. And we know vaccinated staff and vaccinated students can get and spread COVID. So that testing policy is, as Michael Elson-Rooney of the Daily News reported, 1/20th of what Chicago and LA school districts are doing, where they're going to be testing 100% of students and staff weekly.
Wow.
And that's where you catch cases, because if you don't test, then we can't see who has COVID, especially with asymptomatic people. And then we can't quarantine those classrooms. And, I've been reading online that there are people who don't want testing because they don't want their schools or classrooms to get closed because they're inconvenienced. And to that, I'm like, no, you know what's inconvenient but worse? People getting sick and possibly having long COVID or even dying. We can't put people's inconvenience over the health and safety of our people. So I just could not believe the lack of those safety measures in play, especially when the mayor said we are going to have 3 feet of social distancing where possible. Because a lot of our classrooms will not be able to fit 32 students in a classroom with 3 feet distancing. It's just not going to happen.
Right. On top of that, Annie, this year I read that city officials are not setting a specific number of COVID cases to close a school. So what are your concerns with this? There's no determination of how many COVID cases will warrant a school closing. Can you tell me a little bit about that?
Yeah. So even September 1st, during the council hearing, Dave Chachki, I'm not sure how to pronounce his name, the health commissioner, said they will deploy disease detectives to figure out whether there's spread in a school. But as I said earlier, how can you know whether there are cases in a school if you don't test? And why use the phrase disease detectives? Aren't those contact tracers, right? Where's the science around disease detectives? If you don't have guidance on how a school closes or how we know how a classroom closes, but if we don't have guidance on how a school closes and we just have to trust that the DOE's disease detectives can spot spread of cases, there's no real scientific basis on how to close schools at all. I think, a lot of people have been saying, what's 3 feet of distancing? How was that calculated? How was even ventilation measures calculated? And I know that the district has given all schools these carbon dioxide monitors to see how airflow is being exchanged in classrooms, but they're not required to use them in all classrooms. And that would overload our custodial engineers, who are already overworked, working around the clock, fixing the HVAC systems, the piping, all the issues that make schools not very safe for our kids. So the fact that, even just September 1st, they just made this guidance out saying that middle school and high school teachers are going to have to make new paperwork for their students digitally if they're quarantining, and then open office hours. That was brand new news to our middle and high school educators who unfortunately are hearing about their jobs not through the mayor or the chancellor, but through Twitter and other social media platforms. And it's just utterly disrespectful to have us and students on the ground going through untested, protocols that may or may not keep us safe without actually letting us know and having us give input on what will actually make our school safe.
Annie, I wanted to go back to a point you brought up earlier about the vaccination mandates for children. So currently, educators are required to be vaccinated and have at least their first dose by September 27th for the school year. There is no current COVID-19 vaccination mandate for children in New York City public schools, however. How are educators feeling about this?
Yeah, so I've heard from educators that they're upset about the vaccine mandate. At the same time, I want every single person possible to be vaccinated in our classrooms if they're working with children who cannot be vaccinated. And this is not to, you know, disagree. I disagree with my colleagues who believe they shouldn't get the vaccine. I believe everyone should. But that our students, you know, I think as many people as possible should get the vaccines, because we know the hospitalizations, cases, and deaths are mostly of the unvaccinated. And I hear communities who are concerned about the vaccines, but we know, like, overall, we've seen how the vaccine has operated through millions and millions of people. I'm fully vaccinated. I was fine. Many others are fine too. And I would, you know, hope that me and others standing before you saying like these vaccines are safe and will keep our community safe might be enough. I hope my colleagues take the vaccine. I don't know what's going to happen in school if and when people oppose the vaccine mandate. I think that is an issue.
Right. Thank you for sharing. So something else I wanted to bring up was that educators and parents have started a #RestoreRemote campaign. Can you tell us about the demand for remote learning at this time and a little more about this campaign as well?
Absolutely. So the Caucus and many parent groups and now council members and politicians have really pushed for a remote option that will allow for families who still are worried about their children not being able to be vaccinated, worried about household members who are immunocompromised, to be able to stay remote until we have vaccinations. But we also know that vaccinations are not enough to keep our students and staff safe. And we also know that if we were to, you know, make sure our communities are okay, that we need to provide them the Wi-Fi, the devices, the resources necessary in order to be safe, especially when quarantines happen. And they will happen, and children and staff will get sick under this plan. And so instead of having schools flip-flopping and families who are not ready to return be forced back 100% in person, let us have a remote option that actually keeps schools safer. The less people that are in the school building, the better. I will have less kids crowded in a windowless classroom. In fact, if more kids went remote, just like last year, I might be able to have a classroom with windows this year. But that's not possible with 100% in person. And we know that this is an airborne virus. So we know that even our Department of Education workers are working remotely right now as much as possible, because we know that less bodies in the buildings means it's safer. So give families the remote option. Teachers, we all did the remote option last year, and as much as we hated it, it's safer. It's not about whether we feel it's better or not. It's about making sure we're safe. And there needed to be a lot more planning so that all of this doesn't fall on teachers in the fall and for the rest of the school year. And I'm just going to say one more thing, that September 1st at the City Council hearing, Chancellor Porter said that we are ready to pivot to remote learning at, you know, the snap of a finger, which we are not. We are not ready to go to remote learning immediately. The mayor and the chancellor have said since May that we are going to be 100% in person. And when there needs to be a remote option, it will be on educators and staff and families to scramble to figure out how to make that remote option work. And that's not okay. Our mayor and chancellor and the Department of Ed should have been planning a remote option since last year, frankly.
Annie, thank you so much for joining us today. I wish we had more time. Thank you for your advocacy and your activism and your education of our students and our children, especially during these tough times. I hope that, you know, these conversations continue to happen, and that perhaps, you know, that can lead to an extension of some sort so that things can be sorted out before 13.
I agree. Thank you so much for having me.
Well, folks, that's all for our show today. I'm your host, Sonyi Lopez, wishing you and yours safety and wellness now and always. See you next time.